Hello, everyone. I want to welcome you to the Los Angeles County Safe Schools for All School Health Panel. We're very excited to have you join us and we look forward to a great dialogue. We have a great panel here ready to join us. So I'm going to jump right in. I am going to share my screen if you give me one moment. Okay, where is my, here we go. All righty. So again, thank you for joining us for the Safe Schools for All panel. Very quickly, we're going to go through some general instructions and then we'll have instructions and we'll have some brief remarks from our panelists. During the Q&A section right now, all of the questions will be submitted through the Q&A function. So as you hear the panelists speak, feel free to start dropping your questions in. The panelists will engage with you and answer questions as they see fit, but I'll also be scrolling through and asking them themselves. You can identify yourself if you choose to, or you can remain anonymous. As always with this virtual world, if you're having any connectivity problems, I suggest that you just log off and try logging back in and hopefully you'll be able to rejoin us. As I said, I'm excited to share this panel with you. I mean, we're gonna have a great dialogue here. We have Dr. Naomi Bardock, who is an associate professor of pediatrics and policy in the Department of Pediatrics. And she is also the Safe Schools for All team lead. We have Dr. Michelle Bowers, who's the superintendent at Lancaster School District. We have Dr. Sophia Lopes, who is a general family practitioner. We have Dr. Jerry Abraham, who's the director of vaccines at Kedron Community Health. We also have Dr. Alfonso Webb, who's the senior director, Office of School Culture, Climate and Safety with LA Unified School District. We have John Perron, who's LA Unified Community Advisory Committee, and he's gonna serve as a parent ambassador. And we have Gary Hardy Jr., who's with Social Justice Learning Institute. He serves as the Policy and Advocacy Director. And I'm not sure if he'll join, but we did have a student ambassador who's gonna join with us. His name is Neil Pashani. So if he joins, I'll be sure to introduce him as well. So we're going to jump right in. As I said, we have a robust panel. So I'm going to throw the mic, if you will, over to Dr. Naomi Bardock, and she's going to share a few words with you about Safe Schools for All. And you should share your screen.
Yeah, thank you so much, Kimberly. And I just want to say a big welcome and a big thank you to everybody from the Safe Schools for All team. And I'm going to share my slides. Hold on. There we go. So welcome to our school health panel. I'm a pediatrician. I'm a pediatrician at Zuckerberg San Francisco General Hospital, the county hospital in San Francisco. And I come with the perspective, both as a parent, a pediatrician, and particularly a pediatrician for African-American families in my clinic and Latinx families in my clinic, that really were the motivator for me to get involved in this work. And so, you know, we're here really to help people understand what's the science, what do we know about how to do safe schools. So the Safe Schools for All initiative, I just like to describe a little bit about what we're doing. It started in December of 2020. People have been thinking about schools, trying to get things organized, but like this is a clear core initiative with very clear pieces of the framework. Funding to support safe schools. We have to give money in order to support people to have a safe school in the pandemic. Hands-on assistance, because we know it's a little complicated and schools aren't normally public health places. So making sure that the state is providing public health technical assistance, safety measures, tangible things, masks, testing, and you'll hear more about our testing program in a bit. And then transparency and accountability so that people will understand what's going on the ground, what needs to happen for safety. Equity is a core piece throughout all four of those elements of the framework. It actually informs how do we do our funding. We want to make sure those both federal dollars and state dollars actually really reflect the fact that poorly resourced schools before the pandemic were struggling even with things like in Oakland Unified School District, not enough soap in the soap dispensers even to wash hands frequently. And so really supporting those schools to be able to make sure that they too can make sure they have full, safe in-person instruction in a way that like really recognizes that the disproportionate impact that has already been had on those communities. And then finally, state and local safety efforts. So there's a real partnership with the state and local public health and local county offices of education as well, focusing on supporting people to do vaccines, testing, masking, ventilation to support safe schools. So I mentioned funding, over $25 billion from the federal government, as well as from the state government to support these very important layers for school safety: masking, ventilation, COVID-19 testing, cleaning, extra instruction. So those first things, those are public health. Other really also key important pieces for the pandemic is funding to support the extra instruction to make up for learning loss, and then social, emotional, and mental health services as well. And then finally, there's some money that supports a network of the county education and health departments, again, to help make that partnership. It's unprecedented, right? This partnership is so important, and we have to do it together, all of us as communities collaborating and helping to support our kids and our schools to be in this pandemic, but still have safe and full learning. So what's the science behind it? The bottom line is that the research shows that schools can reopen safely and stay open. We've learned some surprising things. I'm a pediatrician, so I put this picture up here. One of the things that was like a big question at the very beginning of the pandemic is maybe kids are gonna spread COVID-19 like they do with other viruses, like the coughs and the colds that they pass around all the time, as I'm sure every parent knows. It was a big question, and it's part of the reason why actually we shut down schools in the beginning. But it turns out that kids do not get COVID-19 as often, and they do not get as sick as adults. They don't pass it on as much. So why? Why do children get COVID-19 less often and are not as sick? It turns out that the science that we learned in about June and July of last year, there's a study that came out that found that ACE2 receptors, which are the doorway into the body for the SARS-CoV-2, the virus that causes COVID-19, those ACE2 receptors are the doorway in. You don't have to remember the name, you just have to remember they're the doorway in, how the virus enters. Our ability to make those doorways varies with age. Elementary students make less doorways compared to middle and high school students that make less doorways compared to adults. So the implications, the meaning behind that is that if you have fewer doorways, that's why there's less disease and more mild disease. The other thing we learned is that most school-age children get COVID from a household adult, and that was really consistent. Greece, Australia, China, Switzerland, Chicago, we found that again and again. And if you think about it, it actually makes some sense. You have a lot of close contact with family members, more so than in schools, right? In a household, you're taking off your mask, hugging, snuggling, all the things that we really appreciate in those relationships, lots of close contact. So the implications, though, are that the vaccination for all of the adults, including teachers, school staff, adults at home, both for students and for the school staff, is really key to preventing infections in kids and provides a wraparound layer of protection for kids in school. And then third, we learned about the layers of protection. Studies from around the world found that there was the Swiss cheese model, which is kind of the right way to think about things. We found that schools can open and operate safely when there's key safety measures in place. When you use the layers of the Swiss cheese where the holes don't all line up, you prevent the virus from passing through. And this is what we do in schools. These are the layered, that's the layered approach we have in schools. So let's talk about the upcoming school year. The goal, the priority for California, for the nation, the CDC, the Centers for Disease Control and Prevention, also for the American Academy of Pediatrics, the guidance that we have for schools, all focusing on supporting safe and full in-person learning, supporting our education, the mental and emotional health of our kids, as well as their social development. So we came out with our guidance just 2 weeks ago on July 12th. It's aligned with the CDC and with the American Academy of Pediatrics. And I'm going to go over basically like what are the layers that we're using in the guidance. So one by one, first of all, COVID-19 vaccine. I mentioned it creates a protective layer. It's a game changer. Since we've had that vaccine, it changes the game for schools. It's safe and effective, and it's good for everyone 12 and older. Those are the eligible ages for people who can get the vaccine. And we know that the vaccine is our pathway out of the pandemic. And when people get vaccinated, they protect other people who are unvaccinated. And we know that our younger kids are not yet eligible. So that vaccination is really helpful for protecting the kids. Masks. There's a universal mask requirement from the California Department of Public Health, CDC, the American Academy of Pediatrics, that everybody indoors in the K through 12 setting is required to wear a mask. Outdoors, it's optional. Why are masks so important? They are a simple and effective way of preventing infection passing from one person to the other. The virus we've learned is actually an airborne virus that passes through the air, and the mask creates a block and prevents that transmission. Ventilation is basically means like, let's get the air changing, moving from inside the room to outside the room. It basically makes the indoor environment closer to being outdoors. And basically it's just a way of cleaning the air. And we've learned throughout the pandemic, good ventilation is a key piece. And there's good guidance from the California Department of Public Health about how to do ventilation in schools. And hand washing. So hand washing is good all the time for preventing any kind of infection, and still very true for COVID-19. Staying home when sick. We know that if you have symptoms, there are many people who have symptoms of COVID-19. Staying home prevents those, the COVID-19 infection from infecting other people. So staying home when sick and getting tested is the recommendation in order to help protect people from getting any illness from you, from other people. We're all in it together. So that's a key piece of staying home when sick. And then testing. Testing is a way of understanding what's going on in our community. How can we identify people? Sometimes people don't have any symptoms. So how can we identify those people ahead of time? And particularly in communities where rates are higher, testing in schools can be a very effective way of helping to prevent infections from coming onto campus. And those people stay home and they recuperate at home, and then they come back when they're not infectious anymore. And then finally, transparency is the last layer. Transparency, that basically means that people should know what the safety plans are for schools. And we've been encouraging people throughout the pandemic. It increases a sense of trust. It allows people to know what the safety plan is. And so schools are actually supposed to post on their website what their safety plan is. And it gives parents a sense of knowledge, empowerment to be able to understand what that safety plan is and have conversations about how is the school doing things to keep things safe for their kids. I also wanted to touch on the Delta variant because it's definitely part of the national and local conversation right now. It's worrisome, but we do have effective tools to help us with this variant. Why is it worrisome? Because it's more contagious. That's what we've learned about the Delta variant. We also know that most of the hospitalized patients with any form of COVID-19, but also Delta, are people who are unvaccinated. So we know that the vaccines are very effective. When we think about tools, vaccines are very effective, including against the Delta variant. It is important, they found, for Delta to be fully vaccinated. So if anybody has only had one shot, it's really great to have that second shot. That really is what gives that layer of protection against any part of COVID-19, but particularly Delta. That's what they found for Delta. And vaccines help stop the spread. It protects you and it protects other people from spreading it. And then the masks are also still a core layer and a core protective piece for Delta. So this is just a picture of our different layers. Vaccines, vaccines, vaccines. It's a truth that we just, this is the truth of the pandemic. They're incredibly effective. They're a great piece of what keeps our schools safe. Masking, ventilation, testing, and staying home when you're sick. And then just to give people another resource, there's our Schools Hub and Parent page. So anybody who has questions, they can go. There's actually a parent page. The website is at the bottom of the screen there, schools.covid19.ca.gov. And it's got lots and lots of information for anybody who's interested in learning more about testing, other things that are going on in schools. It's a great place to go. I'm really looking forward to hearing the rest of the panelists. Thank you guys for joining us and answering questions at the end of the session.
Thank you, Dr. Bardock. We're gonna move on to Dr. Michelle Bowers.
Well, good evening, and I am very excited to be here and honored to be invited to join this esteemed panel on this discussion this evening. My name, as you said, is Dr. Michelle Bowers, and I am the proud superintendent at Lancaster School District. This is my 10th year serving as superintendent, and I am part of the community, and we are anxious to reopen our schools and reopen to in-person instruction. So the questions that you have this evening and the concerns, we hope that we are able to address those so that you too feel comfortable and we are able to instill a level of confidence in the fact that we are going to be returning very, very soon to in-person instruction, and it is safe, we are ready, and we welcome the questions. Thank you.
Thank you. I didn't expect it to be that quick, but thank you. I appreciate it. We're ready for Q&A. That's right. Thank you, Dr. Alfonso.
Good evening, everyone. My name is Alfonso Webb, Senior Director for the Office of School Culture, Climate, and Safety for Los Angeles Unified School District. We are eager, we are pumped up, we're ready to have our kids back, we're ready to have all of our faculty back. We start in a couple of weeks, and so prior to starting, we do have a baseline testing that we are expecting for all of our stakeholders, our students and staff to take prior to returning. We're looking forward to ensuring that all of our safety policies that we have enacted are in alignment with the latest guidance from the LA County Department of Public Health, as well as the state's guidance. And so we're really excited about this return. We understand that there are some concerns out there about the Delta variant, but we understand how important it is for our students and staff to remain masked, masked up. Sorry about that, but we do expect for our policies and practices to be effective against this variant, as well as any other variants that may come up. And so with these practices, we are also we understand that there are some people that are concerned, and so we do have an independent studies approach that's also available. Within that independent studies, we have credentialed teachers that work with students. We also have, should parents select to enroll, they can also go back to the in-person instruction at any time. In terms of the baseline testing that we also have additional sessions that'll be taking place on Saturday, as well as the next two Saturdays from 7:15 to 3:15. I know that's pretty specific for the LA Unified. However, I just wanted to put that little commercial out there for our team, just so that we can get people out there. Also, we do have daily health screening using a variety of tools. We use Daily Pass, which is an electronic system where students would need to submit whether or not if they're symptomatic. From that system, it tells us as administrators if someone has completed their baseline testing or have completed their testing within a week or so. Additionally, we've invested in hiring additional teachers. We've brought on additional instructional materials to ensure that we have a robust academic instruction program. We also have extended programs with Beyond the Bell that offers from grades kindergarten through 8th grade, after care, as well as before care for our students. And it's an opportunity for us to reconnect. We also know that we have social emotional supports for our kids, as this has been a tough year and a half. And so with regards to the students that may have some challenges in returning or challenges in getting used to or getting back in that swing of things, we do have additional counselors on board. And I'm here for any other questions, so thank you.
Thank you, Dr. Webb. Next, we'll hear from Dr. Sophia Lopes.
Hi, good evening. My name is Dr. Anna Sophia Lopes. I'm a family physician and I work in an urgent care where we see COVID patients. I see both adults and children. I'm also a parent at LAUSD. So I just wanted to keep my comments brief and just mention a few things that my pediatrician colleague, Dr. Bardock, mentioned. Number one, the school transmission does mirror the community transmission, but it is not the mirror. And I want parents to remember that children are getting COVID at a lower rate than adults. The reason I had a chance to look through the chat and I saw some questions about why children still need to wear masks. Children are known as amplifiers. So they may have symptoms and they're milder, but after school, when they go to grandma, and if grandma is not vaccinated, that's where we continue to see spread of the COVID-19. Variants happen when the virus jumps to a new host. That's why it's important. And you'll hear many physicians, along with the American Academy of Pediatrics, the American Academy of Family Physicians, talk about vaccination because it is our most effective tool to decrease community transmission and return to normal. So with that, I'll yield my time.
Thank you, Dr. Lopes. Dr. Jerry Abraham. Dr. Abraham, you there?
Hello, it's Dr. Abraham, the Director of Kedron Vaccines. How are you guys doing? Hello,
Great.
Sorry, apologies. Literally traveling to Sacramento as we speak to advocate for more safety policies for our schools and more vaccines. So really appreciate what everybody is doing. Thank you so much for everybody's perspectives. As you know, here in South Los Angeles, we have been working tirelessly to get all of us back to work, back to school, back to life, doing all the things that we love to do, including the fun stuff, whether it's playing with our friends, getting back to after school activities, going to the movies and hugging and kissing on our loved ones. But we really need to do those things safely. So we just want to really help encourage opening up our schools. And for us, definitely that includes, vaccinating those that are eligible. We're excited to have partnered with many schools to vaccinate middle schoolers and high schoolers. And we look forward to vaccinating as many parents and families. We want to be a resource. And we have vaccinated some 300,000 plus people now in South LA. So we know that, as Dr. Bardock mentioned, many layers to the strategy, one of them absolutely being vaccines. We hope that if you have any questions, put them in the chat box, and we are excited and ready to answer them. Let's get vaccinated. Let's get back to school. Thank you.
Thank you, Dr. Abraham, for making the time. I know you're traveling. I appreciate it. Let's hear from Gary Hardy, Jr.
Good evening, everyone. My name is Gary Hardy, the Director of Policy and Advocacy at SCLI, but also a member of the Linwood Unified School District Board of Education in my third term serving. It's a pleasure to be here with you all. As I see the question and answer box very active tonight, I know there is a ton of questions for parents, as this is definitely uncharted territory. And with the both hats that I wear representing SCLI, programmatically, we work to bridge the gap between the school day and our students' learning and development, also addressing a lot of the traumas that students are facing right now because of the impact of COVID in the community, while as an organization standing in the gap where we provide additional access to technology and support for our parents as well, as parents are struggling with this pandemic as well. From the school board side, what I would say, the districts across the country really are having to create plan A through Z as things sort of change by the day. But what parents should know is that we are always acting in accordance with the latest and best information from the LA County Department of Health and LA County Department of Education as well. We do our best to provide a stellar learning environment for our students and our families. But we understand that this situation is dynamic, and we're just asking for all of us to lean in at the same time to cooperate with the best information that we have as far as the mandates for masking. And we definitely encourage as many folks that can get vaccinated. I have family members right now fighting COVID who in hindsight wish they had gotten vaccinated. And we don't want that for our communities, as our vaccination rate in Black American communities still is the lowest among our counterparts. And I can speak to the city of Linwood. We were on the Rachel Maddow show a few weeks ago for being at the epicenter of the COVID breakout, but still in some of the lower tiers for unvaccination rates. So I think it's just a matter of us using tremendous amount of wisdom and caution and working together to ensure that our communities are safe. That is what SGLI believes, and our record with our academic supports in our schools across LA County, into Compton, Antelope Valley, even as far as Houston, Texas, speak to that sort of moniker very well. So again, happy to be here tonight. It's a pleasure and honor to be a part of this esteemed panel, and looking forward to providing any additional context and insight that may be helpful tonight.
Thank you, Gary. Appreciate the words. We're going to end it. I don't see my student advocate who joined, unfortunately, but we do have JP John Perron, who is going to share a few words about the advisory committee he works on, as well as share a few words as a parent.
Hi there. Well, if we were in person, I sure would feel safe with all the doctors surrounding me here today. And now I'm here. You're going to hear a lot of details, facts, data, and numbers. But I'm here as a parent to talk parent to parent. And last year, when it was time to go back to school, we formed, LAUSD formed Health Ambassadors program. And I went and became a member of that. And I want to go ahead and share my screen here and show you what I had. So this is me here. And this is parent to parent. Let me play what I have.
I'm unable to hear the audio.
Oh, you can't. I'm so sorry. I'll start that over, and thank you for that heads up. Let me know, it should be playing now. Hi, everybody. Thank you. I'm John Perrin. I'm a parent at LAUSD, and I'm also a board member for the Community Advisory Committee for Special Education. And I wanted to give everybody a little bit of heads up. There's been a lot of changes. You can go and get tested without an appointment. And if your family's anything like my family, you've worn a lot of different hats over the past year. You've learned how to teach at home with the school on Zoom. You may have brought your kids back to school, and like mine, maybe hybrid learning. You probably learned how to do things in the kitchen that you thought you might never do. Me, I watched all the cooking shows with my kids, and one of my kids even might want to be a chef. So we've been exposed to a lot of things. One of the things we don't want to be exposed to is the virus. I think we all feel the same way about that. You might have learned how to read backwards. But what I'm here to tell you in all seriousness, when it comes to selecting the school, returning to school, to the classroom, you don't have to come back to the classroom. You can stick with the learning at home. There's the hybrid program where the schools are open in the morning. In the afternoon, the children do their asynchronous work. My kids like it because they get to go to school, and the work that they were doing at home is now more like homework. It's a little bit more normal. If you're here watching this video, you're on the right website. So click around, find out, go to the sites where they have no appointment testing available. Get your daily pass. Now you can actually get your kids tested at school, sign the consent form, And I'll make another update soon. Hope things stay relatively the same. In the meantime, I gotta get out of this house. Bye. Best of luck to all of us. Bless us all.
Okay, so that was when we were going back to school after the stay-at-home order. Yeah, and so this was in April. The update is the health ambassadors are being updated, upgraded, going to be more robust. The CAC, we formed a parent ambassador working group, and now it's a standing committee. And we hope that will be the template prototype across LAUSD, because we're giving a voice to the parents, and it's parent to parent communications. We're listening as well as informing you. So I know most of the questions will go to everybody else. I'll try to work the chat and answer as a parent as much as I can. Thanks.
Thanks, JP. Appreciate that. Well, I appreciate all of my panelists. They listened and they moved on through the upfront comments, because we wanted to really make sure that we spent the majority of the time answering these questions. We have a ton of questions, so I'm going to jump right in. One of the first questions I see is, what measures are being taken against the Delta variant of the virus? That's probably more so for one of our doctors. So there any measures that are in place that are specific to the Delta virus?
I'm happy to jump in. Yeah, I'll start, and then happy to hear actually from other doctors also on the panel, or physicians. So those key layers, the masking, the vaccinations, the ventilation, the hand hygiene, staying home when sick, those are all very, very effective layers. I have been encouraging people, schools very much to think about testing as the other really key layer. So it wasn't something that was sort of always part of what we had last year. This year, testing is an amazing resource that it's like a game changer also. We didn't have it last year for the schools in the same way we do now. We have an extremely robust testing program at the state level for what they call PCR testing, and also antigen testing, which is a quicker answer in the schools. And we have lots and lots of people available to support that school testing. So, so that's the thing that I've been encouraging people, particularly as we're trying to figure out what's going on with Delta. That's the thing I've been encouraging people to do. So it's a question that you can ask your schools about. But those other layers are also very effective. We know that if you put them all together, it's that Swiss cheese model. You put them all together, they can make a very safe school environment.
Thank you, Dr. Bardock. Another question we have is, what are the metrics that California State is following to keep schools open?
So I'll answer from the state perspective, and then maybe some of the other school leadership can also talk about how they're thinking about it also, because it's one of those things that there's state decisions, but then there's also local decisions. So local decisions is where the schools with the local public health folks is usually actually how those kinds of decisions get made. So we track the information using the CDC website, which I can try and see if I can put it in the chat. But the CDC actually has a tracking website that tracks state level numbers as well as county level numbers. And then we also get a lot of information from our own testing capacity in the state. So we have a way of getting reports from everybody on the ground up to the state. So we're tracking those numbers daily actually to see what's going on the ground. And I did want to say one other thing actually, which is I answered a sort of technical answer about Delta variant before, and I just really want to acknowledge that I've been reading through the questions in the chat, and that people are really concerned, worried about Delta variant, and I want to reflect that back actually, and reflect that that we are focusing very carefully on the variant and understanding what's going on, and so I want to validate the feeling and see it and reflect it, and also support people to feel like they can see that the layers can actually create that layer of safety for schools. And I'm happy to answer more questions, but I did want to acknowledge that the pandemic is not easy. And so, you know, I hear that and I feel that, and I support people in those feelings. So.
And I will just add one thing from the school perspective, school leadership perspective. What we really use to inform our decisions about how we're going to be prepared and create safe environments for staff members, for students, for families, for everyone returning, we are utilizing that CDC guidance for reopening schools. We are utilizing the California Department of Public Health guidance for reopening schools, and we are absolutely using the Los Angeles County Department of Public Health guidance, the T1 document, and they have each of those sites serve as wonderful resources, and they have very clear guidance about what the expectations are and what schools need to do to make sure that we are ready to reopen and bring kids back. Now, I will speak for Lancaster, but I would say most of my colleagues and most school districts are going above and beyond what those recommendations are. Many are mandates that are in the guidance and the orders, but even above and beyond those mandates, we are increasing ventilation systems. I know the filters, we're doing more with filters to make sure we have better ventilation. We are purchasing HEPA filters. So some of the one-time dollars that the state and federal government has pushed down for improving our environments, we are using those monies to buy shields, to buy masks, to buy more PPE and sanitizing, hand sanitizing materials, equipment, hand washing stations. So we are definitely taking the safety and all of those layers that you have mentioned. We are looking at all of those things because we want everyone to be safe, but we want people to be able to come and focus on school, to enjoy being in the environment and not to be concerned. And I understand the concerns that I see mentioned in the chat box, and I believe we'll have to get back and get started so that folks have an opportunity to see that we are really approaching this very seriously. We have health screenings, as Dr. Webb had mentioned. I believe all of the districts have something in place. Many are still taking temperatures as an added measure to make sure that if we have someone that may not be feeling well or is expressing any kind of concern, that we have an opportunity to take the temperature and move them to a wellness center immediately so that they can get the support and be isolated and quarantined. And then we can test that child with the parent's permission and make sure that they are not testing positive for COVID. So there's a lot of things in place that we're using to kind of guide our reopening, and so that we're prepared, not just in receiving the kids, but how we respond if there are concerns.
Yeah. I'd also like to just jump in, and I want to give some reassurance. From the clinical side, we are anticipating Pfizer to make an announcement regarding their clinical trials with school-age children, ages 5 to 11. I know that's something that a lot of parents may be concerned about. I saw a few questions in the chat. We're anticipating their announcement in the next 2 months, 3 months tops, and it will show safety data over 4 months. So it'll be a little bit different than the adult clinical trials. And I just want to give some reassurance to those who are vaccinated. What we're seeing primarily in the clinical setting in the hospitals are the vaccine is holding up. Your vaccine protection is still there. What we're seeing, it is avoiding hospitalization. So I just want to, say that and reiterate that. And that's why you'll hear time and time again, physicians telling the community to trust the vaccine. It is safe, the data is there. So even against the Delta variant, we're seeing breakthrough COVID, but we're not seeing the same rates of hospitalization as we are with the unvaccinated. So please keep that in mind as well.
And also just to add on to what was shared by Dr. Bowers and Dr. Lopes, within LA Unified, we do have our surveillance testing in-house. And so that gives us some really good data to use to find out if there's any particular areas that have a higher prevalence of COVID-19. And so with this particular data, we're also able to see that, okay, if we have one case at a school site, a possible another case, and if there's an epidemiological link, whether it is a link or not, we do work hand in hand with the Department of Public Health to determine next steps and appropriate steps. And it doesn't necessarily mean we're going to have to close down the school, but we understand how to make this work. We understand also that if a person is vaccinated, that they may have some symptoms, they may not have symptoms, but the idea is that if they're vaccinated, most likely or hopefully they won't have any significant symptoms where they'll be hospitalized. So we do appreciate partnering with agencies such as the state and with the county and looking at the guidance from various entities. Thank you.
Thank you so much for thoroughly answering that question. I love that everybody jumped in. Here's a question about some resources. Are the social, emotional, and mental health services available for educators and teachers in addition to the students?
Yes, there are a lot of resources available for everyone. There's resources available for family members as well. So for staff members, any of the staff members, whether they're teachers or classified staff members, everyone is going through something. So COVID is not just impacting one or two people individually. COVID doesn't care. COVID impacts whoever COVID is going to impact. So whether you're an adult or a child, we recognize that there may be some social, emotional issues that folks are dealing with. And if you are an employee of a school district, I encourage you to contact your human resources department or your risk management department, school counselor, or a school administrator that can connect you with various employee assistance programs or other resources that are available to get you the support that you need. And that would be a confidential conversation. So please feel free to do that. And I encourage you strongly, if you need that assistance or just want to talk to someone, please do that. In many schools, I know our district as well, we're investing in social emotional learning curriculum, and that is going to be something that is shared and taught with students every day in every classroom throughout the district so that they can learn how to recognize different feelings and emotions and how to respond to them, or maybe various triggers that they may be having or something that they were concerned about and maybe not even recognizing that they were having a problem with that. So we have hired additional counselors. We have hired additional school psychologists. We are doing some additional training with our regular staff to be able to more readily respond and observe the needs of students. And then again, for families, we are connecting families with resources in the community because this is a community-wide effort. And I would say that that is true for all of Los Angeles County. There are organizations that are really stepping up and stepping to the plate to say, hey, we are here to support our community. So there are resources available, and I encourage you to reach out to the school districts to find information about how you can be better connected to the resources that are available and the resources that you need.
And I would just add, that in Linwood, we created a 24-hour mental health hotline that was available to anybody in the community. As I mentioned, the pandemic had a lot of side effects, and most of them were producing trauma in communities, just trying to live and get by. So it was important to provide these resources for everyone. And that's sort of what Dr. Byers was alluding to when we talked about going above and beyond. And the idea of equity is not like somebody mentioned in the question and answer box, code for critical race theory, but instead it is the idea of meeting the individual and specific needs of individuals, right? So if we knew that in communities that were dealing with a lot of suffering and trauma, then that district had to do things beyond what was recommended to address the needs of their community. So that meant, like in my district, having a weekly food pantry. That meant having a robust Safe Schools collaborative and mental health collaborative that responded out in the community as was needed, that also addressed homelessness. So with that in mind, there's a lot being done to help schools and communities recover from this pandemic. And a lot of it has to do with things that aren't really about academics, right? It's not about what's happening in the classroom, but what's happening outside. And one of the major things that we have to consider as school districts is when we close schools is the fact that we were closing resource centers for communities. And we have to find a way to make sure that these resources were still available to schools. And again, wearing both hats, it's the SGLIs of the world, right, that provided the support, academic coaching, access to food and technology, when the district did its best, but couldn't meet the entire need, and we stood in the gap. So as I said before, I recommend everybody get in touch with their school's principal to understand the resources that their school has at their disposal, to also understand the learning continuity plans that were passed and approved, so that you're aware of what's being done each and every day to address the concerns of the community. And the last thing that I'll say is about the question of what our students can adhere to. You'd be surprised. Our students will shock you each and every time with the level of responsibility that they can achieve if we just put faith and trust in them and allow them to do so. So Linwood schools have been open since March, and we haven't had one case of student to the teacher, teacher to student, student to family member transmission, and have had any issues with our students wearing masks, regardless of their special needs designation or level in school. So it's possible, but it requires all of us to lean in and be a part of the solution.
I think that's the most important part. We all have to be a part of the solution. So thank you so much for that answer. I think this is an interesting question. It says, what's LAUSD plan for kids due to medical conditions that cannot or will not leave a mask on their face or a shield on?
Thank you for asking. I know that, with regards to kids with special needs, we have to consider what types of accommodations can be made, whether that child may be able to be taught outside or one-on-one with aid that can support or to provide. We don't want to limit the educational experience for any of our children. So the approach would be to determine what types of accommodations would be most appropriate for children that are unable to wear face masks for one reason, for whatever reason. So we will do it in the safest way possible, and we'll work with parents, we'll work with our staff to ensure that it's the safest approach to addressing those types of concerns. Also, kids may also wear a face mask with a drape in those types of situations. So that's an alternative.
Yeah, I'd like to.
Thank you.
I'd like to add to that a little bit. This is JP. The CAC and parent and community services focused stringently on that last question and that last answer. It is being looked at very closely because some physical situations and emotional situations can keep the children from keeping on the mask. And that is being addressed at every single level of LAUSD. I just wanted to reassure everybody that is not being ignored.
Thank you. There's another question. In Los Angeles County, we are hearing that if there is one COVID case, the classroom quarantines for 14 days. If there are 2 to 3 classrooms quarantined, then the school will shut down. Is that accurate information?
No, actually, the guidance has been updated from the county as recent as last night. The T1 document came out about 1:30. We're on it. We check the site daily. But in terms of exposure management, you have to look at each situation as an individual case. It's no set policy. If you have one case, you may have another case on campus. Those cases may not have had any relationship to one another. Even if there are 3 cases, it may not be a linked epidemiological link between those 3 cases. And so it would not warrant a shutdown. Even if there are links, there's no need, if it can be localized to a classroom, there's no need to shut down the entire campus. So when we saw roughly about 25% of our students return, we did have a few cases here and there. We did work with the County Department of Public Health to address those particular issues. We looked at ways that we can improve. We looked at ways that we can make it even more robust of a safer environment for our students and staff. And so when we looked at this latest guidance from the county, we did update our policies to ensure that we are in lockstep with the state and the county and CDC in terms of appropriate steps to take when having positive cases on campus.
Thank you. Let's see. I see that. I just think this is a great question because I think that there are probably some other parents that echo this. And it says, I'm panicked about my 11-year-old starting 6th grade because he's not vaccinated. My older son, husband, and myself are fully vaccinated. Can you ease my fears?
Yeah, I'll start out with that. And then it looks like Dr. Lopes also is coming off mute. I wanted to clarify one thing that the Delta variant piece of it is it's not more dangerous. People are asking in the chat. It's not more dangerous. It's just more contagious, and it is more contagious. But we still know that these layers are actually very effective. And so what I was mentioning before about that slide about children most often get COVID-19 from a adult household contact person, right? So an adult in their household. It means that actually the fact that you're vaccinated is super protective for your kid. So and they did a study actually last year in like November, October, where they looked to see kids who got tested for COVID, both were negative and were positive. Was there any relationship between going to school and having a positive test? And they found that there was no relationship actually between those two things. They did find that kids who said that they had gone to parties or play dates, that they were more likely to have a positive test. So it's the environment that's not the controlled school environment that tends to be where COVID passes around. So that to me is like, the schools are very, they have good routines in place. And we know that in the context of masking that you can really, really reduce risk for whether you're vaccinated or unvaccinated. And we saw those layers were effective even before we had the vaccine. So that was in December. We had a lot of good studies. And then there's even one from North Carolina as early as the end of this school year. So when Delta was already partially in our communities, came out of North Carolina, almost every district in North Carolina. So thousands of kids were part of the study. They were actually just doing testing, standard testing for kids in those school districts. And they found that there were very few outbreaks. They just used masks. They actually had changed, and they didn't have a minimum physical distancing, a minimum, space between kids. And they had kids riding on buses like they normally did, but the masking was really important. And of course, those other layers, the ventilation, et cetera. So those are experiences and sort of scientific studies that can be very reassuring to folks.
Yeah, and I just want to echo those comments, Dr. Bardock. I've been scrolling through the chat too, and I see a lot of questions about the Delta variant. And just to clarify, children can get COVID-19. We never said they couldn't. So we know this. I saw that someone remarked children can't get COVID-19. That is not true. 4 million children have been diagnosed with COVID-19 in the United States. The vast majority of cases are mild because of the physiology that Dr. Bardock explained with the ACE inhibitors, the entry into the cells. So that's why kids have milder disease. Yes, they can also have severe disease, but our infectious disease colleagues are telling us that the data is not there to say that the Delta variant is causing more children to end up in the hospitals. And as Dr. Bardock mentioned, the best way to protect your child is to get vaccinated so we can drive the incidence down. At one point in the urgent care where I work with COVID, we didn't have the vaccination early on in the pandemic, and we were seeing patients, and not one physician or nurse got sick. It's because we had the masks. So that was another question that I saw in the chat about why kids need to wear masks. Masks have been proven to be scientific effective in reducing transmission. So that's why there's a multi-layer approach that does include masking in the school environment.
Thank you, Dr.
Thank you to both the doctors for that. Did someone else want to say something? Okay. I want to ask the next question. It's about social distancing in the classroom. And it says, is there going to be any social distancing in the classroom, 3 feet or no social distancing at all?
Well, in Los Angeles Unified, we are not bound to any specific requirements regarding social distance or physical distancing. However, we are looking at how we can maximize the physical distancing in a classroom. We understand that we understand that the in-person instruction is the optimal instruction for the majority of our students. And so we want to get our kids back, and we want to get them back as safely as possible. So in order to do so, we still will make sure that other measures are in place to ensure that it's a safe environment for our students. So not only will students be required to wear masks inside of classroom, but we are adding an extra level of having them wear it outside as well. We've, as Dr. Bauer shared, the filtration devices, filters, we've installed MERV 13, which is a very high quality filter that are in place. We've also provided air purifiers in our classrooms as well that scrub the air for any types of debris and so on. So with these measures, along with the health screening, along with testing, COVID-19 testing, we have a good solid structure to ensure that kids will be safe.
Perfect. I see a couple of questions about the recording, so I just want to take a pause. Some people joined late. They want to know if this will be replayed or if there'll be another opportunity. I will at the end share some information. We knew that LA County was going to be big, and we have another panel with the same awesome people, and I think we even have an additional panelist that next Thursday. So please, if you joined late and didn't have an opportunity, join us again next Thursday. And again, I'll provide that opportunity, but the recording will be posted too. We'll provide additional information for that. I have another question about now that we're seeing a lot of companies and a lot of government agencies requiring vaccinations, is LAUSD going to mandate vaccinations for their faculty?
At the moment, there is no specific response on that. I know that various agencies within the state have moved to that specific guidance, but at the moment we don't have a response for that. So that that's to be determined on that question.
Okay. Here's another one. Do you have any suggestions to schools on how to decrease the risk when children are eating at lunchtime? They need to take their mask off. You know, we know how close kids can sit sometimes at lunchtime. So what is being in place? What's in place for that? I know sometimes we see in hospitals and different places, they say, don't sit here, sit here. Is that something LAUSD is going to do, or are they just leaving it to the kids to decide?
Right.
And
so,
this is for LAUSD, but we know this is LA County. So hopefully this can be for LA County.
It can definitely be for LA County. I have no problem sharing the questions. You know, in terms of the meals, we understand that kids would need to remove their masks for meals. But like, as I shared before, maximizing the physical distancing will be the biggest way to prevent the spread of infection or prevent any types of exposure. The other thing we're doing is staggering our lunches. With staggering lunches, you won't have as many students out to eat at the same time. On top of that, we're looking at various, we have additional personnel that will be out on supervision to ensure that kids are following through, as well as incorporating some school-wide positive behavior intervention and support measures to reward students for the good behavior of while eating lunch.
And I will just add, in addition to the things that Dr. Webb shared, we are also going to be utilizing outdoor space as much as we possibly can, encouraging students and allowing them to eat outdoors because of the air, the ventilation, obviously. And then also being mindful of the idea of cohorting. So a classroom group, especially in the elementary setting, a classroom group would be looked at as a cohort. And in the cafeteria area, we would seat them together as a cohort in a similar fashion that you would think of a family being together all the time. So little things like that, and try not to have the students mix as much as possible when indoors eating lunch, and then wait until they're outdoors. So we are mindful that we can't control completely all the various situations, but we do have some very intentional plans and strategies that we will be utilizing to promote a higher degree of safety.
Thank you. Is there a limit on the amount of students that can be in a classroom?
With our current guidance, there's no specific limits, no requirements. However, we are cognizant as we are programming students, principals have been made aware that we want to make sure that we do everything we can to work with our populations just to ensure that there's enough space in each classroom. We've worked with our facilities division to ensure that each of our classrooms, and as for LA Unified, we're the largest landowner or landlord for LA. And so as a result of all these properties, we want to make sure we have enough space that we utilize on campuses so that we can make sure that we maximize the distance.
Thank you. This is from a parent who actually supports returning to in-school learning, but they want to know what the threshold is, if there's any, that would cause school districts to consider a lockdown or online teaching again.
I don't want to think about that. Let's just put it that way. The threshold, well, obviously we have a lot of physicians and health organizations that are monitoring the cases. And what would really push school districts in that direction are mandates, the same as what really guided and informed that closure from the beginning. And that was guidance and mandates from the Department of Public Health and CDC, and the rate at which the transmission of the virus was spreading, and those recommendations that were being provided by the Department of Public Health. So when you're responsible for the health and well-being of thousands of individuals, you want to take that very seriously. So that is not something that we felt we were in a position to put families, students, employees at risk. And there were strong recommendations which led into mandates for doing certain things and even to close. At this point, with the vaccine available and with us being in a position where we know far more than we did at that time. At that time when we closed schools, we didn't have MERV 13 filters, we didn't have HEPA filters, we didn't have all the PPE, we definitely weren't donning all these fancy masks that we have now. So we didn't know better, but now that we know better, we are absolutely able to do better. And we still, the best thing that we can do, as the physicians have said, is to encourage individuals, for whatever reason that they may not have gotten the vaccine, just encourage them to check it out, look into it, and please consider doing that, because that is going to help prevent us from having to get down the line to where we might have to reconsider closing schools. But from where I sit, I think we're a long ways from that. The push is to reopen to in-person.
And just to add a little more clarity, the decision to close schools wasn't a same day overnight decision. It happened over weeks. I know my district, we started meeting in January before school closed in March. So it takes a tremendous amount of conversation and information in order to make that decision. Also, the school districts don't have the ability on their own to decide to close a school or classroom. It's a decision that is shared amongst the community as well. So like Dr. Bowers shared, you know, a lot of factors will be considered. What I would say is we're not in the same place we were in March 2020. Definitely not out of the woods, but we do know a lot more in how we can control and stop spread and respond to cases should they arise. And also I can say that most of the exposures that you would see in the school settings, it's sort of adjudicated on a case-by-case basis, right? You start to go into contact tracing, you're on the phone with LA Department of Health and LACO right away. And then the team with the superintendent, school board, principal, administrators make a decision that is best for that local school district. And I think that is going to be our goal going forward. And a parent asked whether or not there's contingency plans. There are, like I said, there's plan A through Z because guidance changes a lot. The different factors may change and shift a lot. So we have to be ready for just about anything, including, unfortunately, and hopefully not a scenario we see again, which is closing schools again, like we did last year. But again, our goal is to ensure the safety of all who are involved in our schools, including parents, especially our staff and teachers who have close contact with our students each and every day.
Like Mr. Hardy shared, we're focused on bringing everyone back. We understand that that's the best environment, the best educational environment for our students. And so we're focused on the positive side of what we're doing to prevent COVID-19 in our schools. So we don't want to alarm students. We don't want to alarm staff. It's all about what we can do. We don't want them to have anxiety about being around other people because we understand that this gap over this year and a half has been a significant drain or a significant strain on students. So we understand that interaction, without necessarily being close, they can still interact with one another in a safe manner, and that's what we expect to accomplish in the fall.
Thank you. We have a question that asks if BUSD, and I'm not sure what Unified School District that is, but I think it probably can speak to all unified districts in LA County. Will they be following the same guidelines as Dr. Webb talked about, or is this only for LAUSD?
To a degree, like we mentioned too, this T1 document is countywide guidance, but again, the idea of local control and decision-making means that we make the best decision that's best for our school districts. And I think that's what you'll see. So a lot of the parents are asking questions as to how they can address their specific district's needs and questions. And that's where you have to reach out in your district and find those answers. I always recommend parents have a relationship with their principal first and foremost, and then be aware of who their community leaders are to share that feedback. But we, between districts, do share a lot of ideas. I can tell you that I have been watching what LAUSD does, Lancaster as well, Dr. Bowers and other districts as well, to see what best practice we can glean from them. Because again, a lot of this we were learning as we went along, and as better ideas come about, we adopt those if they are right for our local districts. So LAUSD is the largest, so they of course have a large spotlight on them, but districts around them are working together. I know the 80 superintendents that meet on a weekly basis with LACO are sharing those best practices and best ideas as well.
Thank you.
If I could, I'd like to ask a question for the people who are not, the panelists were not part of LAUSD also. A number of people are concerned about children getting the nasal swabs constantly, and our kids had the same concern. And the very first time we got tested, they just asked if they could do the mouth swab. And some parents have said, well, you know, one of the people doing the testing said, no, they have to be nasal. And my suggestion as a parent was to insist and ask somebody else who is there and say, can we not get the mouth swab? Because I understand that they're the same. And we have doctors on the panel. Is there a way to address that and reassure people? and let them know.
I'll speak to that, and also one of the other doctors wanted to talk about it, but I did a study, so I'm a UCSF researcher as well as working at the state, but before I came over to the state, I did a study on basically kind of doing a little bit of research to understand about testing in kids, particularly for this reason. How can we do it in a way that kids will actually feel comfortable doing it? And so it turned, the way that we ended up doing it, we did it both a mouth and a nose thing. But the thing we did with the nose is actually we did what's called supervised self-collection, which means they hold the swab and it's just the front of the nose. And then they go at it in their nose for 15 seconds on one side, 15 seconds on the other side. I'm a pediatrician, so I'm going to say it. It's like picking your nose with a Q-tip, and the kids are actually like really very comfortable doing it. And I think there's something about you hold the swab and then the kids feel very comfortable doing with it. The youngest kids, for the mouth thing, they actually had a much harder time. We were also doing supervised self-collection for the mouth. Wow. So they had to do the mouth thing themselves. It just was harder for them because they had to, like, you know, put it in a certain spot on their cheek, whatever. Then, you know, picking your nose is you know, it comes more instinctively, I think, to the kids. So so I think that is a model that actually that's how we do it in the state testing programs for the schools, is that we allow the supervised self-collection. So
that's the choice my daughter did. She held it herself.
Great.
Had no problems whatsoever.
Yeah, good.
Thank you, JP, for that question. Here's an interesting question. City of Angels online learning says that the enrollment window is August 2nd through 9th, while LSUSD is saying the deadline to enroll is July 30th. I'm not sure if anybody can, but can anybody clarify that information? They're asking for some answers.
For LA Unified, we have a survey in which if there are students within the parent guide, their enrollment survey is due tomorrow. So that's where we're trying to get a good sense of how many students will be participating in the City of Angels Independent Studies program. So that's due tomorrow. So if right now there's a small number of parents that have suggested that they want to enroll their students in the City of Angels. So if you are going to enroll your student into the City of Angels program, please do so by tomorrow. That's the deadline.
Thank you. If one child gets exposed at school, will all the kids in that family need to be at home for 2 weeks?
I'll take that one. No. So if a kid is exposed at school, the kid has to stay what's called in quarantine generally, meaning that they stay home just in case they got infected. But if they're not infected, definitely none of their siblings have to stay home. Nobody else in the household has to stay home. It's just that they stay out of school. There are certain circumstances that allows for them potentially to stay in school with testing if they were wearing masks. But generally speaking, the rest of the family doesn't change their behavior at all.
Yeah, and I just want to piggyback on that. I saw a lot of questions in the chat about quarantining. When we have a true exposure, which is someone is in contact with someone within 6 feet without a mask for more than 15 minutes, there's a chance of probably catching something. If they're asymptomatic, we're asking them to test on day 4 post-exposure. Usually what happens is the parents bring them in right away. And at that point, we're just quarantining because you can still have a negative test and then later test positive. So it's really important to follow the guidance of your physician at that time and not go by that one negative test on day 1 post-exposure. And we're asking people to quarantine up to 10 days. Earlier in the pandemic, I can speak for LA County, we changed our guidance, again, based on the science, that if you had an exposure and it was deemed not significant, on day 7, you could release your quarantine with the negative test, given that you had no symptoms. So it's not just timing, it depends on symptoms, and it really does require sometimes a clinical evaluation if you're not sure, either by your general physician or ER doctors, whoever's doing the testing should be giving guidance on that.
Thank you. Should high-risk kids attend school? Those with compromised immune systems.
Those are really important questions that I always say you should talk to your personal doctor about that. So your pediatrician, family practice doc, whoever is taking care of your child, because they're in the best position to help you make those decisions. You know, we know something about sort of how COVID acts in different types of bodies, different diseases, different conditions, but it's pretty individualized at this point. And so that's actually a really helpful question to talk over with your own doctor.
And since we're just on the topic of doctor questions, I just wanted to jump in. And I also saw a question about side effects and myocarditis in children from the vaccination. So I do want to talk about that. We've given about 180 million doses of the mRNA vaccination in the United States. And we saw about 1,000 cases of myocarditis or pericarditis, which is inflammation of the heart muscle or the lining of the heart muscle, which can lead to palpitations, shortness of breath. Most of the cases that we saw were mild. And the guidance from the CDC, the American Academy of Pediatrics, is to still get the vaccine. I also saw another question, you know, if the vaccine is so safe, why isn't it FDA approved? It's currently approved for emergency use authorization, which is slightly different. And the reason why is because we are in a pandemic. This is an emergency. So that's why the vaccination was released for emergency use because of the pandemic. And the safety trials in the adults lasted 2 months. And why, you know, the big question I get was, you know, was that enough time? You know, what if something happens down the line? In the history of the vaccinations, and Dr. Bardock can speak to this too, we don't see side effects after 2 months. And that's why 2 months was deemed the cutoff for when the clinical trials would end. Any serious side effect that you're going to get, you will see within the first several weeks of the injection. The most common side effects that we're seeing after COVID vaccination are soreness at the injection site. Sometimes you might have a low-grade fever. We see headaches. We can see some people develop palpitations or a mild fast heart rate. But the majority of the symptoms are going away within 72 hours. So we're not seeing lasting long, we're not seeing effects on reproduction or infertility. A lot of my colleagues in the emergency room at the surge in LA County, when we were the epicenter of COVID, they chose to get vaccinated and they were pregnant. So the physicians are getting the vaccine because the data shows us that it's effective. So that's the messaging we wanted to bring home.
Yeah, thank you. And maybe I'll highlight one other thing, which is part of the things that they also pointed out when the CDC said that that the vaccine is still recommended for kids, even though we have those cases of myocarditis, that inflammation around the heart, is that we know that COVID itself can cause problems with the heart, and actually sometimes worse than, almost always worse than the vaccine. So it protects you against that as well. And so, so just wanted to highlight, Dr. Lopes is nodding, and so I see you agreeing on that part. And then there's the other side that people worry about, which is that they're worried about their kid getting sick with COVID. And I did want to say that we don't want to spread COVID in schools, but also I want to reassure people that, as we said before, it tends to be very, very mild disease. And the risk of what they've looked at the numbers, there's higher risk of getting injured in a car accident than there is for a kid getting COVID. So the risks we take every day, we say, oh, okay, I'm going to put my kid in the car or on the bus or whatever, like crossing the street, right? That those are risks that we sort of take on. Those are higher risks than what is a risk to a kid, for most kids with COVID. So so there's a lot of protection there just because their bodies are less likely to get it. And if they do, they get it less in a less severe way. So hopefully that's also helpful. And now I'll say one last thing, because I've also been reading the chat, which is that there's some call out in the chat asking about other states that are having pretty high caseloads in adults. And then that also means that there's higher case rates in kids because they go hand in hand. And I just wanted to point out some of those states actually have their policies on masks are that you're not even allowed to ask a kid to wear a mask in schools. So it's just a very different environment, and their vaccination rates tend to be low. It's hard to witness that from across the country, but I think it helps to put those stories and what's happening in those states in perspective, because it's so different from what we're doing in California, which is requiring masks in schools. People are getting vaccinated at much higher rates than they are in those other states.
Thank you. We have so many questions, so I appreciate our panelists actively being in the Q&A so that people can have their questions addressed. We are at 7:22. We want to be respectful of the time. This goes until 7:30, so I'm going to try to ask maybe 2 more questions. We have a parent who says she's concerned about some misinformation. She has 2 kids, one in high school, one in middle school, and they're both vaccinated. Do they still need to get the COVID test? And if they do, how often?
Well, for LA Unified, we were considering initially, if you were vaccinated, that you would not need to retest regularly. But after seeing the recent data on breakthrough cases, we decided to maintain our current stance of our weekly testing for students and staff. So we expect for all of our students and staff to maintain their weekly testing.
Thank you. And I think we have maybe one more. I think some of these are a little bit repetitive. Delta variant cases are doubling every 2 weeks. Is there a potential, well, this is another closure question, and I think we probably addressed the closures, so we're gonna move on to the next one. What type of COVID testing will our child receive? This is another one, mouth or nasal. A lot, I think now that we're getting down to the end of these questions, a lot of them are a little repetitive. So I'm not ignoring questions, but I think that we've probably addressed these. What are your, well, another one. So you know what, I'm gonna go ahead and I'm gonna go to our last slide because these are about remote learning. You know, they're about what happens if your child tests positive for COVID, and I think that we've addressed that. Here's a good one. You mentioned, I'm sorry, these are all, I'm sorry people, but these are pretty repetitive. I hope your questions have been answered. I'm gonna jump to our next slide that shows, again, I mentioned that we're going to be doing this next Thursday again. And so for those parents that joined late, didn't have an opportunity to hear the first part of this presentation, we want to let you know that there is opportunity for you to come back next Thursday with new questions, tell other parents about this, make sure that you hear it again, or you hear more information about it. So I want to share that slide with you very quickly. You can take a screenshot. I know that you can't copy down that registration link right now, but I've also provided an email for you, KimberlyBelcher@legrand.com. If you'd like to email her and ask for that link, she'll be more than willing to share that link for you for next Thursday. But if you want to screenshot this slide, please do. I'll give you a minute or 2 to do that. But as I said, we'll have the same robust panel here. And in addition to the panel, we're going to have an additional panelist, and it's a Title I coordinator with LAUSD. So in addition to that, I want to share this last screen where you can go for more information. Dr. Bardock clearly talked about where you can go. This is the parents portal on Safe Schools for All. You can go there at any time. They're updating it with information. You can find your questions to your answers. And if you can't, you can find out where you can go. There are resources there available for you. So please take this information with you, the parents page, as well as a number that you can reference. And again, we thank you for joining the panel with us tonight. We hope you found it interesting, informative. We hope that we've answered most of your questions. And if not, again, please come back next week and join us. I want to thank all of my panelists. I think that this has been an awesome panel, and I'm so excited that they're going to join us again next week. So with that said, have a great night, and we hope to see you next Thursday. Thank you.
Thanks, everyone. Take care.
Bye.